and to really push these types of registry campaigns out on a local grassroots basis.
And an organ donor can help how many people?
An organ donor can save up to 8 lives through a solid organ transplant, but tissue donation, where bone and skin, cornea, up to 50 individuals can benefit from a tissue donation.
That's amazing, isn't it?
It's incredible. Where individuals who are blind can see. People who can't walk or face amputation receive the gift of a bone transplant. And patients who suffer burns or other trauma can receive a skin donation. And while those types of transplants are not life-saving, they're dramatically life-enhancing.
We passed some legislation within the last year or so, I think, updating some of our donation laws. And what was the gist of that?
The Uniform Anatomical Gift
I know, but I'm letting
law,
you.
Yeah,
was
updated, and it had been, boy, almost 30 years since it had gone through a revision. And the major revision was the number of persons who can legally give consent if a consent is required by a surviving family member. It expanded the number of options to grandparents and nieces and nephews. Essentially, any living direct blood relative can make a decision for you.
And there's a hierarchy that's gone through, or an order that's alluded to first.
Correct.
Yeah.
Yep. And so it expanded upon the number of persons who can give a gift. It also has addressed other issues dealing with medical examiners that can also, for non-hospital deaths, they can report deaths to Gift of Life. And again, many of those individuals want to be donors, but there was no mechanism in our state which would allow those persons to become donors, and now there is.
Excellent. What are some of the challenges that Gift of Life faces? And the main one sounds like, recruiting more donors.
Right. Well, like I mentioned, there are only about 400 patients on ventilators, breathing machines each year that qualify for organ donation. And it's ongoing education of healthcare professionals. You yourself, a physician, having that ongoing medical education is necessary to allow doctors, nurses, and other healthcare professionals to identify candidates for organ donation early enough before the organs begin to diminish in function. Now, one of the keys, though, and there's sometimes hesitance by people to become part of a registry because they believe that if the doctors know that they're in a registry, maybe they won't work as hard to save their life. Well, that's not true. There's actually state and federal law that requires a separation between the healthcare team and the organ recovery team. So it's completely separate.
So when you said as potential donors identified, you dispatch someone to review and to check on consent or to approach the family. It's not the treating nurse or doctor isn't making that decision.
Correct, but we do it in conjunction with them. We wouldn't do it without them, but we have to coordinate what's going on with the patient and their care and where the family is in their grieving process. So we have to work with the healthcare team to decide what the best time is to make this opportunity available to them.
If I'm in need of an organ, what determines where I am on the list, and if an organ becomes available, if it's useful for me or not? How is that determined? You have something to do with that as well, right?
Right. All patients who need a transplant have to be on one national wait list. And so there's a database in Richmond, Virginia, where all patients who need a transplant, the 100,000 patients, all this information is entered. And basically it's their height, their weight, their blood group, and their gender. And there's just that minimal information in the database. When we receive a call from a hospital, the information we need about the donor is the height, the weight, the blood group, and the gender of the potential donor. And those pieces of information are put in the national database, and we see who then prints out. Now, who prints out first and who prints out last is based on a different a different criteria for each organ. But generally, they look at, the database looks at the time you've spent waiting for your transplant. So the longer you've waited, the higher you are up on the list. Size match. So you can't put a really small or really large organ in somebody who doesn't have a similar body size. You have to be blood group compatible. So you have to have the blood compatibility aspect. How far away is the donor from the transplant center is another criteria, because some teams, such as a heart team or a lung team, won't travel a greater distance for an organ. They have to have the donor a little bit closer to the transplant patient. So all of these aspects are woven into the printout that occurs every time we have a donor. And the list is blind as far as how they got on the list and whether they're a wealthy person or a person just barely making it in their life. So when our agency prints out that list, we have no idea who's a celebrity and who's an unknown. It's just a single list, and it's fair. It's a fair allocation process.
And then you mentioned the geography issue. Is it possible to, I suppose, match with maybe an organ in Ohio if you live in southern Michigan? And so do we have some kind of interstate connectiveness?
Yeah. Yes, we do actually. About 20% of our organs that we recover in the state of Michigan, about 1,000 organs last year, 20% of them went to out-of-state programs. And vice versa, those other organs come into the state of Michigan, and there are mandatory allocations. And so a kidney list, for example, is really one national kidney list. And so if there's a perfect match in California, we're obligated to send that kidney to California. And likewise, they're obligated to send it here if there's a perfect match for a donor that they have. Livers are shared within a 3-state region, Michigan, Ohio, and Indiana, for example. So livers can be transported, not quite to the extent that kidneys can, but yet we have general sharing of livers throughout the 3-state area.
We should talk a little bit about our Kalamazoo hospitals. So you work with hospitals around Michigan, and you would work then with Bronson and Borges and Lakeview and Paw Paw.
Yep.
As an anesthesiologist, from time to time we're involved because we provide care to the cadaver donors. They come to the operating room. It's limited, obviously. They don't really need anesthesia, but they may need other supportive skills to keep the organs functioning, so we're called to do that at all hours of the day and night, I might add.
Yeah.
And it's frequent then for a team to come in, to fly in, maybe from U of M or Pittsburgh, or wherever they come in, and they harvest the organs while we're in the operating room assisting. So I know that our local hospitals are very active in participating in procuring organs.
You're right. Once we get consent from the family, or if we have a first-person consent, then we print out the list, and then we contact all the centers, and we find out who's going to recover, surgically remove each individual organ. And so we would coordinate the operating room time where all the teams would come into, like Borges or Bronson in Kalamazoo, and they would have their time in the OR. It takes about somewhere between 3-4 hours for the organs to be surgically recovered and packaged and then prepared for shipment. The hospitals in Kalamazoo do a marvelous job, and actually Bronson Methodist Hospital received a national award for its rate of donors and converting from potential to actual. Actually, both Borges and Bronson have received this national award. And we have had as many as 17 Michigan hospitals receive this federal Medal of Honor, it's called, from the Department of Health and Human Services for their rate of organ donation.
So they must be very good about reporting potential donors early on and such, and helping to facilitate getting consent.